To, Today, we're welcoming back two distinguished representatives of your only local community healthcare system. Keith Page, who's president and CEO of Anderson Healthcare, and Lisa Spencer, who is the chief nursing officer for Anderson Hospital. They're going to speak with us about an update on where Anderson is in its initiatives and about our local COVID. So with that, I'll turn it over to Keith and Lisa. Thank you.
Thank you. To say the last year has been an adventure, I think is understating it. I will tell you this, a few years back, the Rotary Club donated funds in support of our new intensive care unit. And that room and that intensive care unit was extensively used this past year. There are many times over capacity, and so we appreciate the support of the Rotary in the past, and we've worked hard to care for our community this past year. I can tell you I'm so proud of our staff and physicians and all that has been accomplished, and we have more to come. So you'll hear about that from Lisa, about our response to COVID-19. I want to take just a few minutes before we get to that to talk with you about some other initiatives that we have had underway this past year and things that are forthcoming. So first, okay, I want to talk with you about our campus, the Goshen campus in Edwardsville. And okay, there we go. About 5 years ago, we purchased 15 acres of property at the intersection of Goshen Road and District Drive and began developing that. We're the first new residents of the town center complex developed by the city of Edwardsville. And we have made some progress. This is the property that I was speaking about, and I think all of you know where the location is. We first began development of a surgery center. That construction was completed last summer, and we are in the process of going through the licensing and accreditation requirements for the surgery center, but we're excited about that. We also have another building under construction as we speak. This is a rehab hospital. It's Anderson Rehabilitation Institute, and that building, the construction will be completed and will be opening in September of 21. And just a little bit more about Anderson Surgery Center. It includes a clinic with Cardinal Glennon Children's Hospital, 6,000 square feet, and they are rotating their general surgeons, ENT, urology, orthopedic surgeons to that clinic as well. And then they will be able to perform outpatient surgery at that surgery center on our Goshen campus. In addition to that, we will have our community surgeons will also have that facility available. A couple of views of the building. Inside the Cardinal Glennon Clinic, which is open right now, and they are seeing patients there. And then on the other side is the surgery center. We also have an imaging, we have an X-ray, and we have lab draw for patients that require those prior to their surgery. The Anderson Rehabilitation Institute, this is an image of the facility. It's a 34-bed freestanding rehab hospital. We have had inpatient rehab services here at Anderson for many years, but this really takes it to the next level where a dedicated hospital that this is all that they will be doing there. So patients that have had strokes, patients, brain injuries, people that require extensive rehabilitation services, they're going to be able to receive those right here at Edwardsville. And this is really the only facility like this in southwestern Illinois. So what's coming up next? So we continue to have plans for the Goshen campus, and our next building is right here, up in the kind of left-hand top corner of this image. the medical building that we are in the process of getting approvals. We have approvals from the city. We're now going to the state. It's a 50,000 square foot medical building, and it will have an imaging center. It will have laboratory draw area. It will have outpatient rehab services, have an urgent care. And then on the second floor of this facility, we'll have approximately 20 primary care providers. Some of those will be consolidated from individual offices that we've had out in the community, but there will also be additional providers that will be brought to this facility. So this, we're going to break ground on this in the spring of this year, and we'll be opening this up in June of 22. So we're excited about that. And as you can see from this image, there's room for a couple more buildings that we'll be looking at for future planning. So that's really all I wanted to cover right now about our plans for our Goshen campus in the future. I am now going to turn this over to Lisa Spencer, and she's going to talk to you about our COVID update here at Anderson.
Hi, and good afternoon. Thank you for having me here today to talk to you about our COVID plans and all the things that we've been working on and doing to take care of our patients in our community. I just want to start by, I never would have dreamed, being a nurse for 27 years, that I would lead during the time of a pandemic. Not something that you're ever educated and trained, but we've had a great team here at Anderson and a lot of people who have done a lot of great work to ensure that our patients are safe. So I just kind of want to go over the history and what we've worked on and what has been happening here at the hospital over the last year. We started with discussions in January of 2020 when we started hearing in the news about the outbreak in China. We then formed a subcommittee in February of 2020 that we started looking at a lot of items in preparedness and kind of activated our emergency preparedness committee and our incident command. So as far as incident command goes, there were 4 of us individuals who really kind of took a part in a lot of the planning and the strategies moving forward. So with myself, Eric Brandmeier, our emergency preparedness director, Doris Driscoll, our infection prevention and employee health nurse, and Andrea Burns, who is one of my nursing directors, also involved in employee health from that perspective. So we did a lot on planning, looking at our PPE, which is personal protective equipment, to see that we had what we needed for our staff and caring for these patients, to look at both our local stockpile and then looking at our resources that we have from the strategic national stockpile, which is those that are issued by the government. We looked at all of our supplies and equipment, what type of patients that we would be seeing, what we would have available to take care of them. This included everything from beds to ventilators to anything that we might need at the bedside to take care of a COVID patient, and how that care might look different from the traditional patient that we were taking care of. We looked at our units and what beds we had available and what capacity we would have to take care of patients, because we kept hearing that we would exceed our capacity. So we had to have surge plans and staffing plans into place. And obviously infection prevention, looking at hand sanitation stations, and again, just how we protect our staff and looking at the guidelines for mask utilization and so forth. We do a lot of work with our local EMS service, and Eric, who I mentioned, is actually over our regional EMS providers. And he did a lot of work in planning and working with our EMS as well to ensure that they had the equipment that they needed, the supplies that they needed, the care plans that they needed to take care of patients as well. We had a lot with staffing, as I'm sure many of you did in your businesses, and in planning for taking care of keeping your businesses running. There were initial travel restrictions. There were many illnesses that we had to also take into consideration. Schools were starting to close that day in March when really everything kind of shut down. No one was prepared for that. And, we're a 24/7 operation, and we have a lot of people that depend on us. So there were a lot of things that we had to put into place to see how we could accomplish taking care of our patients. We did have to implement screening at the point of entry with purchasing new equipment to have the thermometers and scanners and people and resources at our entrances to be able to screen all of the public before they entered our facility. We did immediately put visitor restrictions into place. We started in our emergency department, which we then later extended to other areas throughout the facility. We suspended a lot of activities with extra people coming into the facility with our volunteers, our students. We didn't have large meetings. All of you, Zoom, became our best friend to accomplish any business. So we just had to really change the way that we were doing things. We actually saw our first positive patient on March 17th. Shortly after that, we did get direction from the Illinois Department of Public Health that we needed to stop performing elective procedures. And so these were procedures done in the OR and our GI lab that were not life-saving procedures. So if they weren't emergencies, then we were instructed that we needed to stop performing those. So if you can imagine, that again was a one-day notice, and we had a large staff in our surgical services department and a lot of patients on our schedule. So we had a lot of work and changes to put into place. We redeployed a lot of those staff to some of those entrances that I talked about, to some of those other care areas. So we were happy that we were able to utilize those staff in other capacities. We did also close some of our other services. We closed our Express Care locations in Troy. We closed down our Maryville imaging location, our sleep lab, and our health management center. And we did that because we were seeing a decline in volume, and we were seeing that those probably, again, were more of those elective places that patients would not be visiting as frequently. And we did more online things with some of those cardiac and pulmonary rehab patients. And then we worked at getting access to more home sleep studies so that some of those could be done on an outpatient in the homes versus being present in our sleep lab. We established a manpower pool to assist with many of the operations throughout the organization. This last one, minimization of aerosolized procedures. What this was is something, what they said with the spread of COVID, when you did a procedure that would cause secretions or aerosolization to happen when you were taking care of a patient, that all staff were at greater risk. So we had to do a risk assessment throughout the organization to see where those things would take place and how we would handle those types of procedures from that point forward. We did also receive an analyzer for the RT-PCR testing, and this was actually given to us from the state of Illinois. They were looking for a site in Southern Illinois to be able to perform these testing processes, and so we worked with the state of Illinois, and we gladly accepted this analyzer. We did put a process into place that we have a testing site at the corner of 159 and 162. And this has been successful. We were doing up to 250 swabs per day. Thankfully, we're down to less than 100 at this point in time. This is the gold standard for testing. So this is not a rapid test. This is a test that's a swab, and it goes on this analyzer, and we can get results usually within 24 hours, sometimes less than 24 hours, as long as we have everything that we need to do that. And these were state-issued supplies as well. So we did have a few bumps along the way with getting the reagent that we needed to get the test results and to have the swabs that we needed to be able to perform that because of the demand, particularly in the Chicagoland area. We did establish a COVID hotline. So this was something we had to put together for our staff. We had to have guidelines in place of when and how to return to work, or if they were exposed, whether they felt they were exposed in the hospital, in the community, at home, whatever it might be. We needed to put guidelines into place, so we had standardization of the work restrictions. We have providers through our Anderson Medical Group who these employees call into, and we have criteria set from the CDC to follow for return to work. We were able to resume elective procedures and surgeries on May 11th, which we were happy to do. With that, we did have new guidelines that all patients who were having those procedures had to have that COVID test done within 72 hours of their procedure. So we put that population of patients with the testing at that testing site, and again, more coordination for resuming those elective procedures. We did at that time just resume procedures that maybe didn't result in a patient staying overnight, or if they did, it was less than 24 hours if we had other beds available throughout the facility. So we've done well with that. We continue to kind of look in restricting some of our surgeries at this point, and I'll talk about that a little bit further. We did receive our first supply of remdesivir. Remdesivir is a medication for treatment of COVID patients on May 16th, and we have been religiously using that for our patients who are in-house. We were able then to reopen services. Maryville Imaging reopened in June, our Express Care in July, our Sleep Center in September, and our Health Management Center also opened in September, and we have been able to keep all of those services open and operational up to this point. This is a slide that shows you some of our numbers as of February 17th, and our cumulative positives, we've had 681, and we have had 86 deaths in our facility. So just to talk a little bit about where we're at today, my numbers today, I started the day with 12 positive patients that were inpatients in the hospital. 2 of those patients are in the ICU. 1 of those patients are on a ventilator. I have 4 patients who we call them PUIs, or persons under investigation. So they've been admitted with COVID-like symptoms, and they have been swabbed, and we're waiting for those test results. To compare where we are today, we did have several days that we were over 30 with positivity rate in the hospital with number of patients. I did have a day over the weekend that we were down to 7 or 8 positive patients. So we're creeping up just a little, but hopefully we'll see that decline over the next few days. We are doing well with our personal protective equipment and having a lot of supplies available for our staff. We've added high flow oxygen and new devices to be able to care for our COVID patients, in addition to purchasing new ventilators to be able to care for them. Our hotline continues. We have had a surge plan to take care of our patients because, as Keith mentioned, that ICU, we have been at capacity or over capacity. So we did have to have alternate care areas to take care of ICU and critical care patients. We did start a plan on November 30th with continuing our elective procedures and utilizing more of those surgical services staff to deploy to other areas so that we could keep open additional beds and have plans for additional critical care patients, which we did utilize up until just a few weeks ago, where we did send those staff back. We had to form a surgery review committee. That was a requirement from Illinois Department of Public Health with physicians to be able to look at resuming surgical procedures and having all of those things into place so that you don't keep patients who need an inpatient hospital bed unable to get one, or keep them in the emergency department boarded. So we've had weekly meetings at times, if not every other week, meetings with those surgeons to ensure that we're safely continuing to do procedures here. We did institute BioNex rapid testing in our Express Cares. So all of our Express Cares now have a rapid test. If a patient presents with COVID-like symptoms, they have the capability to test there. It's not a testing site, but if they're seen as a patient, if they are positive, it is a positive. If they are negative, then we do a PCR test, and that swab is sent here for future results. We are doing monoclonal antibody infusions at our cancer center, and these are for patients who are positive and having symptoms, and they're positive within 10 days of the symptom onset. And these are drugs that are given to help prevent patients from coming to the hospital and or worsening. And there are certain criteria that we have for these infusions, but we have done over 35 of those since the first of the year. We've changed our visitor restrictions as of the 11th of February, that now all of our inpatients can have 1 visitor per day. Our surgical services, we're resuming a visitor accompanying the patient as well. Our biggest thing is the vaccines, and we have been very successful in having vaccination clinics for our employees, as well as satisfying those in Group 1A, that as outlined by the state of Illinois, providing to our fire departments, our EMS, our police departments, the veterinary services, all of the physician offices and their staff. We are looking at, on March 1st, we will be having a vaccine clinic at our Troy Express Care location. We're actually not going to be doing Express Care services there starting that date, and we'll have vaccines available for people in the community who have Anderson healthcare providers. So, and they have to meet the criteria or the tiers. And we're currently in tier 1A and 1B, and there are several criteria. If you have any questions about that, I'll go over that. But they will be referred to a website by their providers, and our website goes through the questions to determine what tier those people are in. And then they will receive a call from our staff, and they will get scheduled and go to that location for vaccine. So we are at an advantage at Anderson. We have the capability to do ultra cold storage for the Pfizer vaccine, and not many in this area, if any, have that capability. So we have been fortunate to be able to receive the Pfizer vaccine. The Pfizer is one that's at ultra cold storage. There's a lot of criteria, and it requires reconstitution by a pharmacist, but we are able to take on that task because we have that type of storage available. So I could talk for probably hours about this, but in the interest of time, I want to give opportunity for anyone to ask me any questions.
I have a question.
Sure.
Did you guys have to buy special equipment like freezer stuff to be able to store the vaccine, or it was something you already had?
We actually had the ultra cold freezers. We had those at our cancer center and in our lab. We had them at our cancer center for some of those investigational drugs that we might utilize for clinical trials when we opened our cancer center. So we had those available.
Lisa, there's a question in the chat room. What's the maximum number of COVID patients Anderson could handle?
I don't really have a maximum number of patients. Obviously we are 154 beds, and those beds include OB, and as well as, some of the other in the bassinets in our nursery. So obviously we wouldn't want to fill that. I can tell you that we looked at the time whenever we made the change with our surgeries and we redeployed those staff at that November 30th timeframe. We were kind of looking at the St. Louis Pandemic Task Force and their projections of tripling your number of COVID patients, which at that time would have taken us to 90 patients. We would have been able to manage 90 COVID patients, but if we put other patients into that mix, and if we surged because of other health reasons, that could have become complicated. But we were thankful that as I said, we got in the high 30s, but we didn't get beyond that.
This is Keith. Just to add to that, probably our most challenging time in terms of our capacity was around the end of November.
Yes. Mm-hmm.
And that was a time when we were pushing our capacity, but we were able to take care of the patients. But what is interesting is the same time that was happening here, the hospitals in St. Louis were also at their capacity. Mm-hmm. And then some of the smaller hospitals that refer patients to Anderson because they don't have ICUs and some of the equipment that we have, that was getting a little concerning because there was just no movement available because everyone was, stretching. But fortunately, we made it through that without ever having to, not be able to care for a patient that needed to be cared for here. And we were able to help out some of those smaller community hospitals too.
Right. Any other questions?
We've got another one in the chat. Have you been receiving enough vaccine?
I would have to say yes. We have at this time we've received enough to meet the needs of the clinics that we've had. As I said, when we start March 1st, we've already been in conversations with the Madison County Health Department. They are the ones who are in charge of the distribution. So they have an idea of our plan for the number of vaccines that we want to do per week. So we just have to keep informing them, and they're the ones who continue the supply to us. Now, I know at the county level, I don't want to speak for them, but at this point to start for March 1st, we feel that we're in a good position to start our clinic.
Could you share a little bit about herd immunity? A lot of us have heard that word, and it's the first time we've ever heard that and have no idea what that really means, and what's the importance of that?
Well, I think there's a lot of different definitions or kind of outlooks of herd immunity. And, I think there's a lot of debate of whether we'll ever reach herd immunity versus, the vaccine, utilizing the vaccine. So I would prefer actually not to comment a lot on that, just regarding there's so much out there in the media and so forth. So it's just a matter of, to me, it's just doing what's best with what resources that we have available and putting all the preventative measures in place that we can. Versus just, having everybody go out there and acquire the virus thinking that we can reach that herd immunity and that the number of people to be immune to this, because, so far we're a year in and we haven't accomplished that.
Gotcha. And I forget what level we're at, according to what the governor has set up on the tiers or whatever. And I think the last one, the best level is when things really open up wide open, is that when I guess the vaccine's available. And could you describe that a little bit more about, I guess, how many people or percentages or whatever needs to be vaccinated for us to get to that level?
Yes, I actually have not seen what they're saying would be the percentage of vaccinated. It's that it has to be available to all. So I can say right now, with looking at the tiers that they've put into place, that hasn't happened because we're still, vaccinating 1A and 1B. There also is new information on the 25th of February that they're doing a second tier in 1B that includes individuals 16 to 64 with comorbidities, and they have a definition of comorbidities. So, we have to get through those levels. They haven't even released. They have a draft of what 1C would look like, but that is not at this point final. So to get to that phase 5, I think there will be more information and more to come.
I think the one thing that everyone needs to understand is the vaccine is not going to go as fast as everyone wants it to.
Right.
Our plans with our clinic are that we'll be doing vaccine administration through the rest of the year. It's just going to take that long to move through these various levels and phases. And, it's not as fast as everyone wants it to move through, but that's the reality of it.
Right. I would agree with that.
Okay. I have 2 more questions in the chat box, and I apologize up front if I butchered this one word. What's the protocol for administering vaccines to individuals who have experienced anaphylaxis like those with food allergies?
At this point, any food allergy is not a contraindication to getting this vaccine. So currently, it's if you have any allergies to any ingredient in the vaccine. And if you read the ingredient of the vaccine, you probably don't even know that you would have an allergy to something like that. So I would just say that if anybody has had any anaphylaxis to any type of vaccine, that they should definitely talk to their healthcare provider and get the permission, or make sure that they're okay with them receiving the vaccine. But that's what the current guidelines are at this point.
Okay. And how many COVID strains have been identified here in Madison County?
I don't have that answer. I don't want to answer that incorrectly. So
okay.
I do know that we are being asked now for any PCR testing that we will need to hold on to our swabs so that we can send those in to look to see if there are any variants that we're detecting here, and particularly anybody who has been fully vaccinated. If they were to become positive with a PCR test, they definitely want that swab. So some of our requirements are changing as far as being a testing center as well.
Gotcha. Any other questions from anyone?
I have one more, sorry.
Sure.
This is also equipment related. I've only been in through the POB, but there is a very large machine to take your temperature on your wrist.
Yes.
How many of those did you have to buy, and do they serve any other purpose? Because that seems like a very big thing for just a little wrist temperature.
Right. Yes, we purchased 2 of those. We have one at the main entrance. And actually, it's interesting, that's also can be used as a metal detector as well. But we purchased it because we wanted the ability to take the temperature, so we haven't been using that. But that is the other purpose of the machine.
Right. We also have another device at our hospital entrance. It looks like an iPad that takes temperatures. And then we have one at our physician entrance that is a badge swipe, and it's a facial recognition that also takes temperatures. So all of our entrances, we're still doing temperature taking by some type of device or another.
You never know, the metal detector might come in handy someday.
Someday, yeah.
Yes. We hope not too soon.
Yeah.
One more question's come in. Any idea of when the Johnson & Johnson vaccine will be available?
I have not heard the definitive date at this time, and that's for those of you that probably most of you have been keeping track of it. That would be the single dose vaccine. So the Moderna and the Pfizer that we have available now is a two-step vaccine, which we have been very successful so far with having the vaccine available to do the two-step and have everybody return for their second dose.
Yeah. The industry rumor is June.
Yeah, right. But they have to
yeah.
get the emergency use
Right.
authorization and everything. So still several months yet.
Okay, cool. Any other questions from anyone? Well, if not, Keith and Lisa, thank you for taking the time out to share all this information. You can tell by the number of questions, it's on everybody's mind. And it was very well presented. Thank you very much. Applaud you guys.
Thank you.
Thank you. Thank you for having us.
Mm-hmm.